Turning now to a Target 12 consumer investigation moving the needle.
Last year, there were just 372 cases of measles in the U.S. This year, the highly contagious virus has sickened more than 1,000.
And health officials fear that number will continue to climb.
As Target 12 consumer investigator Susan Campbell found out, Rhode Island has a high vaccination rate for MMR overall, but the numbers vary widely depending on the school.
There have been measles cases in several New England states, including Massachusetts and Connecticut, but so far none in Rhode Island. The health department credits that to a statewide 97% vaccination rate against measles. But as we found out, that number doesn't tell the whole story. By kindergarten, kids are supposed to be vaccinated against several illnesses, including measles.
It's my feeling that the reason we haven't seen a case of measles in Rhode Island yet is because we have really good vaccine rates.
Dr. James McDonald from the Rhode Island Department of Health says more than 97% of kindergartners have received the MMR vaccine for measles, mumps, and rubella. By district, the rates of kids who are fully vaccinated are the lowest in Bristol, Foster, and Johnston. You can dig into the data even more on schools, both public and private, where rates for the MMR vaccine swing from just 33% up to 100%.
Is there a health concern in those communities where the vaccination rate may be lower than the state average?
So when you see vaccine rates that are lower in a community, there's a greater risk. I'm not sure it rises to a health concern because our rates overall are still quite good.
The health department is doing outreach to schools where MMR vaccination rates are lower than 95%. And parents of school-aged children received this letter encouraging them to make sure their kids have received 2 doses of the MMR vaccine. But Dr. McDonald knows it can be a tough conversation.
There's one thing I think this national conversation needs is respect and listening.
I'm not anti-vaccine, I'm pro-choice.
Madalena Chirniota is the mom of 3. She says none of her children have received the MMR vaccine.
Nobody wants the measles. I'm not saying that there can't be adverse events, but there are also risks to the MMR vaccine.
Data shows injuries from vaccines are extremely rare. According to information we reviewed from the National Vaccine Injury Compensation Program, people received more than 125 million doses of measles vaccines between 2006 and 2017. Only 143 were compensated for injuries. But Madalena says she still has safety concerns. Her kids don't qualify for medical exemptions, so she used religious exemptions to decline the vaccine.
I'm actually not a religious person. It is my truly, sincerely held belief that certain vaccines are not in the best interest of my children.
According to the CDC, before the measles vaccine was used, an estimated 3 to 4 million people got measles each year in the U.S. Of those, 48,000 were hospitalized, and an estimated 400 to 500 people died.
Because the vaccines are so safe and so effective, we've lost that historical perspective of how bad these vaccine-preventable diseases are, but it doesn't mean we should let up on the future.
Measles starts with a fever. Other symptoms include cough, runny nose, red eyes, and tiny red spots that start at the head and spread to the rest of the body. With the Target 12 investigator Susan Campbell, Eyewitness News.
Now, a Target 12 consumer investigation moving the needle. At 5, we showed you how vaccination rates for MMR vary widely depending on the school.
But that's just one vaccine. The health department tracks all of them. New at 6, Target 12 consumer investigator Susan Campbell explains why overall vaccination rates in the state decline as kids get older.
Almost 96% of Rhode Island kindergartners have received all the vaccines the state requires. In 7th grade, that number dips to about 75%. We wanted to know why. Most of Rhode Island's kids have received all of the vaccines the state requires.
When we look at our vaccine rates in Rhode Island, they're really quite good. In fact, in some ways, they're some of the best in the country.
The rate of immunized children kind of goes down a bit as kids get older. Why does that happen?
Yeah, so the vaccine rates do seem to dip a little bit as kids get older because the requirements then to be maximally vaccinated change.
Only Rhode Island, Virginia, and Washington, D.C. mandate the HPV vaccine for a child to attend school, according to the National Conference of State Legislatures. According to the CDC, the vaccine helps protect against cervical cancer. The law to add it to the vaccine schedule was controversial when it passed in Rhode Island in 2015.
Children get to 7th grade, if they haven't had at least one of those vaccines, then they're not considered fully immunized. Just keep in mind that doesn't mean they haven't had the other vaccines. They've had the measles, mumps, and rubella vaccine. They've had the chickenpox vaccine.
I think sometimes it's very all or nothing, and it's almost treated like a religion, like you must do this or your child will die.
Madalena Chianyota is the mom of 3. Her kids aren't old enough for the HPV vaccine, but she has declined other vaccines for her children using religious exemptions.
I think it's important to look at each vaccine, what the vaccine is for, how long that vaccine lasts, what the side effects are, what the rate of adverse reactions are, and then look at your child and apply some common sense to that.
Injuries from vaccines are extremely rare. According to the National Vaccine Injury Compensation Program, for every 1 million doses of vaccine distributed, about 1 person is compensated for an injury.
Massachusetts lawmakers are considering a bill that would ban religious exemptions for vaccines. With the Target 12 investigator Susan Campbell, Eyewitness News.